Assalamu alaikum class. Today we have the demonstration of the bone of the lower limb, fibula, in which we are going to discuss its bony feature as well as the muscle attachment. So as you all know that this is fibula bone and it is the lateral bone of the lower limb, leg, the lateral bone of the leg. The other bone which is medially placed is tibia, which has been discussed. Now, if you see a fibula, first you have to determine its side and the upper and the lower end. The upper end, if you see, is the expanded part of the bone. This is the whole bone. The lower part is somewhat flattened from side to side and anterior posteriorly it is expanded. The lower end of this bone is broken, so you can appreciate the lower bone in the lower end in this bone as well, right? So the lower end is flattened from side to side and expanded anterior posteriorly, while if you see the upper end is somewhat expanded and broad. After you determine the upper and the lower end, then you will decide that which side of the bone is medial and which of them is lateral. On the medial side, you are going to see the articular facet both on the upper end as well as on the lower end, right? So on the upper end, the articular facet that articulates with the tibia forms the articular facet for superior tibulofibular joint, and as a result of which we can say that this is facing medially. So by having the look at this bone, you can say that this bone is of left side, right? Why? Because the facet is facing medially towards the articular facet of the tibia, and if you see the malleolus, the lateral malleolus, it is expanded and the tip is directed downwards and laterally. So the lateral, it is facing this lateral side and this is the medial side, so it means the bone is placed in this way and the bone is of left side. Right, now I will explain the bony feature first and then the attachment. For the bony feature, this bone has more prominent bony features. It's the real bone. So this is the upper end. The upper end is expanded and have a circular articular facet for the superior tibulofibular joint, which forms the joint with the lateral condyle of the tibia. Just posterior lateral to it, you can see the bony projection that is moving, or you can say facing posterior laterally. This is known as the styloid process of the upper end of the fibula. Now just medial to it, you can see a depression or a groove which is a C-shaped groove, and in this groove we have the attachment of a very important muscle, which is the biceps femoris, right? So the biceps femoris is attached in this groove which is present between the articular facet and the styloid process. Now after just below the expanded part or the head of the fibula, we have the constricted neck of the fibula, around which one important structure is present laterally, which you people should remember is the common peroneal nerve, because the fracture of the fibular neck results in the damage to the common peroneal nerve. Then comes the shaft. Now this is the shaft of the fibula. Now the shaft has 3 borders and 3 surfaces, right? It is usually very difficult to identify the borders and the surfaces of the fibula, since it is very thin or lean bone, but I would try to explain the detailed features of the borders. Now this is the border, the anterior border of the fibula. How will you identify it? You are going to trace it from the lower end. The lower end, which is triangular on the lateral part, if you trace it upward, this sharp border is the anterior border, right? So this sharp border, which is arising from the lateral malleolus and moving upward towards the head, towards the articular facet present medially on the head of the fibula, this border is known as the anterior border of the fibula. Just medial to it, you are going to see the sharp border, which is the medial border of the fibula, right? So the surface between the anterior and the medial, which is also known as interosseous border, is known as the medial surface of the fibula, right? So this is the anterior border, this is the medial border, and the surface between the two is the medial surface. Now if you move posteriorly, there is a sharp border which you can see is directed on the posterior part, continues with the posterior part of the articular facet of the head of the fibula. It moves downward towards the, here you have a facet for the talus on the lower end, which I will show you in the other bone when we will come to the lower end of the fibula, right? So this is a sharp border which is present posteriorly, continues from the posterior part of the articular facets and move towards the lower end towards the articular facet of the talus present on the lateral malleolus. So this is the posterior border. Now in between the interosseous or the medial border and the posterior border, you can see this sharp muscular ridge, which is known as medial ridge, a crest, right? This is the medial crest or ridge, which is present posterior to the interosseous border and anterior to the posterior border, right? So the surface between the interosseous or the medial border and the posterior surface is now known as the posterior surface, right? So this whole is the posterior surface of the fibula. And then we have the lateral surface, which is present between the posterior surface of the fibula and the anterior surface of the fibula, right? So this whole is the lateral surface of the fibula. So this is lateral surface, this is the posterior surface, and this is the anterior surface, the medial surface of the fibula. So we have three borders and three surfaces: the anterior border, the medial border, and this is the posterior border. And similarly we have three surfaces: the medial surface, the posterior surface, and this is the lateral surface. Now comes the lower end of the fibula. Now you can appreciate the feature of the lower end of the fibula in this bone. This is the lower end of the fibula. You can see the lateral malleolus, the tip of the lateral malleolus is directed downwards laterally. That forms the lateral malleolus of the ankle, which is palpable easily and seen easily at the ankle joint, right? At the ankle. Now on the medial part or the medial surface of the lateral malleolus, as you can see, it is flattened. Anterior posteriorly it is expanded, but medial and laterally it is flattened. So on the medial part you are going to see an articular facet anteriorly, which is somewhat triangular. This is the articular facet for the talus bone, which is the tarsal bone, one of the tarsal bones. So it forms the joint with the talus, that is the talofibular joint, right? And posteriorly you are going to see a fossa, which is known as the malleolar fossa, right? So the fossa on the lateral malleolus is known as malleolar fossa. Right, now on the posterior part of the lateral malleolus, as you can see, this is the anterior end and this is the posterior end. Now on the posterior end you are going to see the groove on the posterior part of the lateral malleolus, right? This groove is formed by the tendon of peroneus longus and peroneus brevis, right? So there are some of the features which you should learn on the lower end. That is, anteriorly we have the articular facet for the talus, posteriorly we have a malleolar fossa, and on the posterior surface we have a groove for peroneus longus and peroneus brevis muscle. Right, now one by one we are going to discuss the attachment of the fibula. On the upper end, I have already told that on the groove there is an attachment for the tibia, for the biceps femoris, right? Tendon of the biceps femoris gets attached on the groove which is present between the articular facet on the medial surface and the styloid process. So here we have the attachment for the biceps femoris muscles. Okay? The insertion is present over here. Right, now we come to the shaft. Now if you see the shaft, first of all we will discuss the medial surface. On the medial surface, this is the medial surface which is present between the anterior and the interosseous border, right? So on the medial surface we have the attachment in the upper 1/3 and the middle 2/3 part. We have this long attachment of extensor pollicis longus. Okay? We have, extensor digitorum longus. We have the attachment of extensor digitorum longus, right? And on the lower 1/3 part we have the attachment for peroneus tertius. This is the attachment for peroneus tertius muscle. This is the extensor digitorum longus muscle. Now on the posterior surface, if you see a little bit posteriorly, this black is the attachment of, all of them are the origin, right? There is an origin for tibialis posterior muscle, and below it we have on the lower middle part of the shaft of the fibula. On the medial surface we have the attachment of or origin of extensor hallucis longus, right? So we have extensor digitorum longus, we have peroneus tertius muscle, tibialis posterior muscle, and extensor hallucis longus muscle on the medial surface. Then comes the lateral surface, which is present between the anterior and the posterior border. On the lateral surface you have the attachment origin of two main muscles which you can see. Above we have the origin of muscle. So on the lateral surface, on the upper part we have the origin, on the upper 1/3 part we have the origin of peroneus longus muscle, and on the lower 2/3 part of the shaft, middle shaft, we have the origin of peroneus brevis muscle. Right, so in the lateral surface we have two muscles, peroneus longus on the upper part and peroneus brevis on the lower part, which somewhat extends on the posterior surface as well. So this is the lateral surface, this is the medial surface. Now comes the posterior surface. So this is the posterior surface in which we have the origin of two main muscles. We have on the upper part we have the muscle which is soleus communis soleus muscle on the upper 1/3 part of the shaft of the fibula. Posterior surface we have the origin of soleus muscle, and on the lower part we have the origin of muscle which is known as flexor hallucis longus muscle. Right, so on the posterior we have flexor, and on the medial surface we have extensor muscles. So this is whole the attachment of the shaft of the fibula. Now comes the lower end of the fibula. The lower end of the fibula, as I have told you, has forms an articulation with the talus bone, which is one of the tarsal bone. So on the anterior part we have anterior talofibular ligament, and on the posterior part of this facet we have posterior talofibular ligament. Right, so the two ligaments that holds the talofibular joint together. Just above the lateral malleolus you can see this triangular area. So on the anterior part of this triangular area we have the attachment of anterior tibiofibular ligament, and on the posterior part we have the attachment of posterior tibiofibular ligament. Right, so this ligament holds the lower or inferior tibiofibular joint. And then we have at the tip we have another ligament which is joined with the calcaneum, one of the tarsal bone, and forms the calcaneofibular ligament as well, right? And as I have told you before, on the posterior surface, there is a groove for peroneus longus and brevis. So this was all about the fibular bone. Thank you.